Ready?
Yep, we found the patella.
Okay, this is the patella. This is our kneecap. And this is a sesamoid bone because it runs within the ligaments of the quadricep tendon and the patellar ligament. So it's within that tissue. And the patella then is very important for us to be able to throw our lower leg out. So it acts as a pulley in order for us to be able to stride and to do forward locomotion. Now the different parts of the patella, the superior surface now then is the base, and this then is somewhat flattened. This is the superior surface, that's the base. The inferior surface then is more sharply pointed, and that is the apex. On the posterior or side of the patella, there are facets, which are the articular facets, and these then will tie into the surface of the femur, and so it'll run like this back and forth on that femur. Okay, our lower leg bone on the medial side is then the tibia. So this is the tibia, this is the weight-bearing bone on the medial side of the lower leg. And the tibia then is the second longest bone in the body, and so this is a secondary bone that determines our height. Now on the proximal end there are the condyles. There is then the lateral condyle and the medial condyle, and they're going to attach to the condyles of the femur. Now in between the two condyles then there is the intercondylar eminence, and this is a superior projection, and this is for the attachment of the ACL, which is the anterior cruciate ligament, and the PCL, which is the posterior cruciate ligament. On the anterior surface, just about an inch down, is then the tibial tuberosity, and this then is for the attachment of the patellar ligament. Now on the distal end, on the medial side, there's a very large projection, and this then is called the medial malleolus, and that medial malleolus then will help form the ankle joint. Now on the lateral side of the distal end there is a depression, and this then is for attachment of the fibula. Now the secondary lower leg bone now is the fibula, and the fibula is more for balance. So it is not a weight-bearing bone. It's more for balance and help us to keep us in our upright position. Now the head of the fibula then is on the proximal end, and on the distal end is the lateral malleolus. And so the two malleoluses then of the tibia and the fibula will help form the ankle joint. Now will fit into the ankle joint and the ankle bones, and the ankle bones then are called tarsals, and the very top tarsal then is called a talus, and talus then you can see how it fits into the tibia and into that fibula. And so this then is the talus. This is a very crucial tarsal bone or ankle bone, because this is where the weight of the body is born, and this is also where the movement occurs. So as we move our ankle up and down, it's going to be moving back and forth. So it's a very critical bone in the talus. The other very important bone is the calcaneus, which is then the heel bone, and the heel bone is taking all the pressure when we land. So it's what's called a striking force. And so when we're walking and running, this is what's going to hit first, and then as we roll over our foot, we'll push off of our large toe more so than the lateral toes. And also then the Achilles tendon ties into the calcaneal bone. And so two very important functions of the calcaneal. Okay, on the distal lateral side, the bone then is a cuboid bone. This then is tying into the little toe and then the fourth toe. On the medial side and on the middle is in the navicular bone. Okay, and then so this is on the distal medial side are three bones, which are the cuneiforms, and they are numbered. The first are the medial cuneiform, the second are the intermediate cuneiform, and the third are the lateral cuneiform. So these are the three cuneiform bones. The foot bones, which are very important for maintaining balance, are numbered Roman numeral 1 through Roman numeral 5. Okay, and they consist then of the proximal base, the shaft, and the distal head. Our toes then are called phalanges. They consist of three rows: the proximal row, the middle row, and the distal row. And our big toe ends up being called a hallux, and the hallux only has a proximal and a distal row. And that is it on the skeletal system.